This is a C. Jason podcast, and I'm Chris Yuan from Walter Reed National Military Medical Center, representing my co-authors, Lisa Prince and Robert Nee, and the members of the Nephrology Education, Research, and Development Consortium, NERDC. Our consortium developed and prospectively validated an objective structured clinical examination, or OSCE, to assess the ability of nephrology fellows to manage three ubiquitous and critically important acute dialysis skills: acute CRRT, initiation of maintenance dialysis, and medical and dialytic management of life-threatening hyperkalemia. It's a simple, low-cost, case-based simulation requiring only standard order sets and a quiet room. Questions are open-ended. It's a formative test designed to be given, graded, and then discussed with the fellow at the program level. Fellows have the opportunity for self-assessment in a low-stakes setting, and program directors may identify potential curriculum deficiencies. 15 training programs and 117 fellows participated. The 10 validators, who were board-certified practicing clinical nephrologists, performed significantly better on all scenarios than did fellows. But first-year and second-year fellow performance was about the same. Dialysis therapy skills seemed to be learned primarily during the first year of training. Overall, fellows did quite well on the acute CRRT scenario. Fellows did less well with maintenance dialysis initiation, and least well with the management of life-threatening hyperkalemia. Often, they lost points because they did not include sufficient detail or seemed to be following a one-size-fits-all prescription. 77% of fellows agreed that the OSCE was useful in testing proficiency in ordering acute KRT. There was no correlation between second-year in-training exam performance and OSCE scores. The NERDC is a consortium of academic and practicing clinical nephrologist volunteers whose goal is to develop and evaluate educational tools for nephrology training programs. One strength of the consortium is the participation of non-academic nephrologists who know the skills required in day-to-day nephrology practice outside of training programs. We welcome those with an interest in nephrology fellow education to participate in the consortium.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.